You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host, John J. Tassoni Jr., with today's guest.
Thank you for joining us for another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please pick it up. It saves lives. You can call URI, you can go to your pharmacy and pick it up. Get it, put it in your car, put it in your purse, take it out of your car at night because the weather prohibitive, but it saves lives. Too many losses this year, too many. Even though it's a 7% reduction, we still have too many. My guest today is Executive Director of AdCare Rhode Island, Sarah Hogan. So welcome, Sarah, and thank you for joining us today.
Hi, thanks for having me.
So tell us a little bit about what's happening down at AdCare. Here some big things are happening.
Yes, yep. So currently AdCare is a 59-bed detox residential facility. We have outpatient at a satellite office in Warwick. We have been working on expanding the building, so we're adding 20 additional beds. That's been in progress for quite some time now, but we're close to finishing up, so opening should be coming within this year. That'll allow us to help 20 more individuals who desperately need the care that we're offering. Really going to start expanding our horizons, really focusing a little bit more on mental health as well, because we know that addiction and mental health go hand in hand. So really going to expand our services a little bit more. When
you say expand your services, are you talking about like outpatient services? What
no,
are you talking about?
We really want to focus a little bit more in depth on the co-occurring aspect of addiction and really start working on not only your addiction recovery, but some of those mental health barriers that people present with as well. And we really want to expand our services to help in that way also.
So do you really need 20 more beds? Are you full?
We do. There are plenty of people who are calling every day to get a bed, and we just don't have that availability. The 20 beds will open up that availability for the people who desperately need the help right now.
So is it men and women, or women with men? How is that?
Yep. So it is co-ed. Women and men do not share rooms, but they share a unit. Yep. So you will have men and women on the same unit. We have detox and residential as separate units, so they're not on the same unit together, but men and women do.
Do you see any way that we're coming down with overdoses and less people going into treatment? I mean, I know that, with the rest of the providers, when I talk to them, there's like 3 or 4 day wait to get in, and we're seeing more alcohol than we are opioids now. It's almost like a perfect storm.
Yep. Yeah, I'm not seeing less people trying to get in, but we are seeing the substances changing. At AdCare Rhode Island, I don't know if you're hearing this elsewhere, but we are seeing an increase in methamphetamine for individuals trying to get into treatment. It is not at the same level as individuals using opioids or alcohol at the moment, but a significant increase of individuals coming in for methamphetamine treatment.
Is that more male than female?
Yes, at the moment, yes.
Yeah. So, you have a beautiful facility out there. I've been there plenty of times. When people arrive at AdCare, are you getting many that just say, let me go see if they have a room. Let me drive up there. Let me take a tour of the facility. Let me look around. Because, sometimes, you get the calls, and, oh my God, I'm not going to go all the way down there. Do you get that a lot?
We do. We get some people who just drive in and see if there's availability. We do get requests a lot for tours to see what the facility's like. More of the requests that we get, though, are inquiries about our staff and their qualifications, which I think is highly appropriate when you're seeking treatment. We have families and patients who are calling just to ensure that when they're sending their loved one here, that we have staff that are qualified to treat them.
So let's talk about staff.
Sure.
Are you behind the 8 ball with staff?
No,
is it hard to?
I think everywhere right now in healthcare is hard. I wouldn't say we're behind the 8 ball with staff. No, I think we are hiring. Just like most healthcare facilities at the moment, but we're staffed fully to our census and able to help the individuals coming in to get care.
So, I mean, a lot of people ask me this question. I much prefer to give it to you
Yeah.
than me answer it. So, give me a knock on the door. I want to take a tour. I want to get my loved one in. What does that look like?
A tour?
Yep.
So, due to confidentiality, HIPAA 42 CFR, we can't take anybody who is not a patient to any patient-facing areas.
Correct.
So they're not going to be able to see any bedrooms or any of the common areas where the patients are. What you can see is our admissions area. You can see all of the common areas like the lecture hall, the gym, the cafeteria, any area where patients aren't currently residing, you'll be able to see.
Yep.
You can talk to our admissions director, clinical director, any staff that maybe you have questions about what the program's like. We answer all those questions. If your loved one is with you and we have a bed available, they could admit right that day if they're comfortable.
Okay.
Yep.
Yep.
If there isn't a bed available, we can make an appointment for the soonest bed available.
Yeah. How often does that happen?
That there aren't beds available?
Oh, no, the tour.
Pretty
Is
often.
Is
Yeah.
it like weekends? Is it?
It's usually during the week, and we usually prefer to do it in the morning hours, but really can work around anyone's schedule. It happens, I would say, once every couple of weeks that people are requesting a tour.
Yeah. Are you seeing anything different that's coming in? I know you said methamphetamines. You know, I'm also getting calls about marijuana laced with fentanyl. I'm also hearing, you know, on the alcohol end, more and more people with alcohol poisoning. Are you seeing those type of things coming to the front door?
Yeah, the significant increase in marijuana being laced with other substances. Patients coming in testing positive for fentanyl and truly acting or being surprised because they have never used fentanyl in their life. And,
Really?
Yep. So there's definitely pressed pills with fentanyl in it. We're seeing a lot of that. Individuals are using benzodiazepines, testing positive for fentanyl because their pressed pills are being laced with fentanyl as well. So.
You know, and I say this all the time, the dealers have a lot of time on their hands to do what they want to do. But also on the other hand is that, you know, the DEA is really hurting the issue of opioids. Because if you have major surgery and you're only given a certain amount of pills, everybody's pain tolerance is different.
Yes.
So if you have like knee replacement surgery, shoulder surgery, and others, and you can't tolerate the pain and you have to continue with opioids, and you can't get them, where are they going? They're going to the street.
Yes.
And they're getting bad stuff that they think is pressed pills that look like opioids or look like, you know, whatever pill you're on, and then all of a sudden we got a problem. We just had this issue in Smithfield.
Yep.
You know,
Absolutely.
3 gentlemen were driving around town, and 2 passed away in the back seat, and the driver was still driving.
And as you know,
Excuse me for 1 second,
Yeah.
but thank God the police had Narcan, and they saved all 3. But go ahead.
yeah,
sorry.
but as you know, people are different as well, right? So I may be able to be prescribed pain medication after a
Right.
surgery and take that pain medication as prescribed and never need it again.
Right.
You may not have that same reaction, and your reaction to being stopped on those pain medications will be different than mine. Individuals are very different on what they can tolerate
Right.
and, you know, their ability to either stop or not stop.
Right.
It's different based on
I
individuals.
want to talk more about that when we come back. We're going to take a break. You're watching Recovery TV, and I'm your host, Sean Tassoni. We'll be right back after these messages.
And now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, Sean Tassoni. AdCare is in the house, and they're our prime sponsor of Recovery TV, so thank you for that. And the executive director is here, Sarah Hogan. So welcome back, Sarah, again. Look forward to continuing the relationship between AdCare and Recovery TV. I want to talk to you a little bit about what we had ended up before with the reaction of medication, and everyone's different. So there's been a bunch of overdoses pertaining to older folks, i.e. the surgery issues. how would you explain to the folks that are watching, if you don't have enough pain medicine, you need to call your doc. Don't go to the street, because we don't know what's in those pills. And you see it on a daily basis.
Absolutely. Yep. I think, well, I know, I mean, just watching the news really should give you that answer. The danger in getting these substances off the street is extremely high. Your PCP, your surgeon, your provider, whoever prescribed those medications to you, is the one you should be contacting if you're in continued pain, because there are other options for pain management other than opioids.
You bring up a good point, because a lot of people don't know that.
Yes.
That there's other options for pain.
Yes.
There's, you know, whether it could be a host of different things.
Yep. You know, some of the medication-assisted treatments are used for pain management as well. Not all of them can be, but some of them can. And it's about taking the right path to get either more pain medication or get off the pain medication. It's very important that you slowly taper off that too. If you've been on pain medication for a consistent period of time and you just stop, you know, there's a danger to that as well. So working with your doctor, working with your care team who provide your medication to either maintain or get off of those medications safely is very important.
Do you guys also offer acupuncture
We do.
where you're at?
Yeah.
Can you explain a little bit about that?
Sure. So our acupuncturist comes in once a week, and they focus on the ears. It's to decrease anxiety. I've actually tried it myself as one of the members of the group. When our acupuncturist first started, he offered us to try it, and it is phenomenal. I was a little skeptical at first. You know, you think, how are needles in my ears going to help me with anxiety? But there's pressure points that they focus on, and it really does reduce your anxiety.
You know, you hear a lot of people talk about acupuncture that, you know, oh, you're full of baloney, that doesn't work. But
I could feel my body melting into the chair as the needles were in my, yeah. It was a really cool experience, and it worked. So ever since I tried it, I really promote it for the patients to try it as well. We also have yoga.
But let's go back to acupuncture.
Yeah.
What kind of degree of folks stay with it in order to relinquish their addiction?
Yeah, so we have found at least 20 to 30% of our patients have stated that they've continued with acupuncture. That is based on our follow-up phone calls. We usually follow up with our patients and ask them how they're doing, and about 20 to 30% of our patients continue with acupuncture.
What about pain? Does that acupuncture help pain?
We don't offer it for pain, but I have read that there is acupuncture for pain.
Okay.
Yes.
And so what else? What else do you offer over there?
We offer yoga. Yoga and acupuncture. We also have a gym, basketball court, volleyball court for extracurricular activities. Our treatment model is based on evidence-based treatment, psychoeducational groups, a lot of holistic treatment as well. And we have a multidisciplinary team of nurses, doctors, psychiatrists, clinicians, support group individuals that are there to all assess.
Do you have outpatient services at that facility?
Not in North Kingstown, no. We have an outpatient satellite office in Warwick, right in the same parking lot as the Warwick Mall.
Okay, so that is still open?
Yes.
Yeah, because I visited that facility at one time.
Yep, that's still open.
So what's next for AdCare? I mean, obviously you got the 20 beds.
Yep.
But get that aside. You open the 20 beds soon. Then what?
You know, we really just want to continue growing and helping more individuals, really, especially on the outpatient side as well. You know, outpatient is as important, if not more important, for continued treatment for individuals. You know, we all know if it was as simple as going to a 5 or 6 day detox, then nobody would need treatment. Yeah. Right? It's about the continued support afterwards.
Yeah, I'm hearing a lot about the construction guys because they have to be into work early. They get out early, you know, and they want to continue their progression, you know, because that industry, construction industry, is probably the highest for pain and people getting hooked on opioids and alcohol and whatever. So it is important that you have outpatient treatment available for whoever.
Yes.
Because if they don't get it, then they have that urge to reuse.
Absolutely.
And then we have another problem.
And we offer multiple levels at our outpatients. We offer the intensive outpatient, which is 3 to 5 days a week. We also offer outpatient, and then we offer early recovery group, which is a continuation after IOP.
How many people attend a outpatient meeting that you have?
It fluctuates based on the day, but we normally have anywhere between 7 and 12 individuals in the group.
Both mixed company?
Yeah.
What is the biggest one? Is it for opioids? Is it for alcohol? Is it for mental health?
Right now, we're seeing a lot more alcohol than we are opioids, which, as you stated earlier, was kind of a change in the trends that we've been seeing. So we have more alcohol in our groups right now.
Why do you think that is?
I don't know.
Cheaper?
Yeah.
You can go to the store. You can have it delivered to your house now.
Yeah, I mean, I think the accessibility has always been there. There really has been a change in, like, the generations, I believe, have a lot to do with it. This younger generation who's growing up right now, you know, I have cousins who are in their 20s and they don't drink it. They don't go out and socialize drinking. That's not what they do. They're smoking marijuana.
Yeah.
So I think even as that generation gets older and starts seeking treatment, you're going to see a change there as well. You know.
Yeah. I want to talk when we come back about treatment for marijuana. That's the $64 question lately. You're watching Recovery TV, and I'm your host, Sean Tassoni. We'll be right back after these messages.
Now, back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, AdCare. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, Sean Tassoni. Sarah Hogan from AdCare is in the house, and they are the prime sponsor of Recovery TV. So thank you, Sarah, and thank you for joining us today.
Thanks for having me.
We left last segment about talking about marijuana. More and more kids, you stop at a red light, you go into a store, you can smell it. It's everywhere. But now we're hearing stories about kids with issues pertaining to psychotic issues pertaining to marijuana. You had indicated that you guys may be doing something with treatment of marijuana. How is that going?
Yeah, we try to help individuals who are trying to come in for any substance. It's our intention. Marijuana being legal now is so easily accessible, just like alcohol, that it really is everywhere now. And when we try and bring somebody in for treatment for marijuana, it sometimes is successful, it sometimes is not. And that is mostly, or it's all really due to some insurance companies at the moment still don't approve treatment, inpatient treatment for marijuana, because there is no actual detox from marijuana. Well, when you go for opioids and alcohol detox, you could die from alcohol withdrawals, you can die from opioid withdrawals. With marijuana, they don't consider there to be a chemical detox from the substance, so a lot of it is comfort medications, and the insurance companies usually will refer to either a PHP or an IOP. So even though we do try and we offer treatment for marijuana with comfort meds and groups and education, a lot of the times it's unsuccessful at inpatient level of care because the insurance companies don't provide it. We do offer self-pay options, but and we do offer treatment, but most of the time we're referred to outpatient treatment, PHP or IOP for marijuana.
Well, Sarah, I want to thank you for coming on today, and thank you for becoming a prime sponsor of Recovery TV. We look forward to your continued support. Thank you. And thanks again. Next week, it's Beth Bixby and Margaret Holland McDuff. We're going to be talking about children's issues. So please join us. If you see something, say something. We'll see you next week.